Is evidence based practice a barrier to commercial success of physical rehab units? Great greetings. This is Ravi Shankar, physical rehab business analyst and coach on Zero Pesa. So, I welcome you all to this amazing session because what we are going to discuss today is a very practical concern, a debate which normally goes on in the fraternities and especially amongst the private practicing physiotherapists, occupational therapists, prosthetists and orthotists, that whether this when we talk about evidence based practice, right? So, how practical it is to implement the same in private practices, right? So, we'll be having a look into this matter in a business from a business point of view. So, the basic concern here is that when a clinic or for its home services, a private practicing physio, OT, or a prosthetist orthotist, you know if they are looking forward to adopting evidence-based practices, then how easy it is as a process, and how effective it is in boosting up their revenues. So normally, if you are listening to this or if you're watching this video, then you would have if you're a private practicing analyst in these fields, then you would actually know that what your views are, right? So let us try to test those views which you hold personally, and that is what the purpose of this session on Zero Paisa is. So we are looking forward to understanding the process, that how effective it is. Normally what happens in any private practicing clinic or a home service, there is an assessment. Physiotherapy, occupational therapy, or prosthetics and orthotics goals are for that particular patient are drawn out, and outcome measures are obtained following these rehab interventions. And these these outcome measures are regularly compared with the outcome measures which have been obtained, right? And then there is a needful modification as per the comparison which is drawn. So any needful modification or continuation of the program is ensured. And then steps from 3 to 5, as you can see on the screen, that once you modify, then you again get measure, then you again compare that with the evidences. So normally this is how a evidence based practice, integrated private clinical practice, or anywhere clinical practice, rather than to say private, clinical practice anywhere would, it would proceed in this manner. But then how effective it is, how feasible it is, how easy or uneasy it is for a private practicing person who is investing time, money, and effort in getting patients, and then they have to ensure that within the stipulated time the maximum number of patients are attended to. And then you also have to, given the nature of fields, we have to spend some good amount of time with each and every patient. So does that leave any professional with a quality time to maintain the process of integrating evidence based practices, right? So let us have a look at this through two calculations. Let us do a very simple two calculations. Number one, what is the expected number of patients who can be treated in and around your clinic, right? There is a population, then there would be a certain percentage of the population which would be requiring to be treated with physiotherapy or occupational therapy, prosthetics and orthotics, right? So how many of them are actually turning up, and is this number staying the same almost every, say, 2 quarters or every year? So if the number is more or less remaining the same, right, then this is a concern. If the numbers are increasing, suppose your clinic, your workshop, your home services are increasing, and all your staff is working at a full capacity, your whole setup is working at a full capacity, then definitely you are in a growing stage. But if it is staying, the number of cases which you are handling, right, the number of sessions which you are conducting in any given year, if it's more or less the same, not much of a difference year by year, then this indicates a problem in business acquisition. Second calculation which has to be done is, like, a patient comes in and is stipulated that okay, this patient would be undergoing this many weeks of rehab, this many days of rehab. So is that particular patient continuing throughout the stipulated time of rehab, or is discontinuing prematurely? For example, a shoulder pain patient is coming in the clinic and is stipulated to say for about 2.5 months, right? Given the all the comorbidities and everything. But if the patient is discontinuing, say, 2 weeks, 3 weeks, 4 weeks from the date of start, then that is a premature discontinuation of services. So if you calculate the number of patients who have discontinued and add on the numbers for how many sessions they were required to undergo before the goals of rehab that were drawn initially. So if you add those numbers and you multiply that number with the average price of your services, say 200, 300, 400, whatever you charge, then what you need to understand is you need to see how much money with respect to time you have untapped. Untapped means there was a potential in the market since you're having same number of patients every year. Whereas if you come to a conclusion, no, there are many more number of patients exactly there who can actually be benefited with your services, but they haven't reached you. So that is an untapped revenue that hasn't yet turned up to you. And lost is patients who came but they didn't continue your services for the stipulated amount of time. So untapped revenue and lost revenue, if you add these two numbers, right, try to just figure out roughly whether it is in hundreds, whether it's in thousands, or whether it's in lakhs, right? So greater the number is, right, the more you must believe that yes, evidence based practice is definitely needful for you. But just wait a moment. I'm just not saying that you have to mandatorily get into it, but how to decide whether to get into or not, right? So we'll be seeing this further. So the basic thing is that if you're able to convert this process, right, the process which we discussed over here, that assessment, physiotherapy goals, outcome measures, then comparison with evidences, then needful modifications, and then repetitions. Now this as a process has to be integrated into your practice, right? You can't think that if I am going to integrate my evidence based practice into my normal routines, without doing that I'll be able to integrate also, and I'll be also be able to uh, manage this and tapped and lost. It is not feasible. This requires some time for you to formalize what is to be done and how it is to be done. So this session, further sections of this presentation will be dedicated to understanding that if you're looking forward to integrating evidence based practices into your private practice of your clinic, of your workshop, of your home service, then how you should be going about it, right? So you have to process how you are acquiring the patients, how you're retaining them, and what point of time when you're releasing them from your optimal duration of physical rehab. So you have to make this into a process, so that this process is facilitated by your evidence based mechanism, as well as at the end of it, it also facilitates back your evidence based practice. So it's like a cycle. You use evidence based practice to acquire patients, to retain them, and provide them with the best of the results. And then whatever results you get, you have to utilize that result to acquire more patients. So this cycle has to go on, right? So here's the actual process. Now, just for a snapshot, I have see the first process I have included in this slide at the top right corner, and you can see yes, 1 to 6: assessment, physiotherapy goals, outcome measures, compare regularly with evidences, ensure needful modifications, repeat 3 to 5 till goals are achieved. Now, you see the red and the blue. Basically, why the red and the blue was there? Because red is normally which everyone does. Blue is for is a step which is when you try to inculcate evidence based practices, right? So 1 to 6 was the initial understanding that how it is normally perceived as, but way to go, right? So here I'm actually mentioning 11 steps where I mentioned that we require to processize is a word, it's not a standard word, but I'm just using it to make it just more convenient and understanding that from acquisition to output, and again that result should be helping you acquire more patients. So the first thing is that you have to prioritize your personal evidence based practice. EVB, sorry, it should be EVP, bank creation, right? Now evidence based practice is something which for which you'll have to create your own data, that for which condition you will be having evidences with you, so that you take care of those patients and all. So I'll just give you a small that how you prioritize. Number one, you should try to create a evidence based practice for kind of patients or conditions which report to you the most at your clinic, or the kind of patients which you see or your team members see at home, whether it is more of shoulder, whether it's more of stroke, whether it's more of post surgical cases, whether it's more of sports injuries specific to knee and back. So you have to most the more and here what your clinical data is very crucial for you, right? I always say as a business coach that you must know your numbers. So the most frequently reporting conditions in your clinic, in your home, in a private practice, they must first create a evidence based practice bank of your own for those conditions. Second is your core skill related conditions. Now core skill is like it's your top end expertise. Out of 10, there are two conditions for which whenever a patient having that kind of a condition comes in, you feel that okay, the best person to treat this kind of a condition on earth is me, right? Now that is the skill set. For example, if we take an example from the medical side, that an orthopedician who's expert in knee replacement, right, and is not doing shoulder replacements and so shoulder surgeries, he never promotes himself in the market for shoulder or back. It doesn't mean that he won't be treating them, but as far as his promotion is concerned, he'll be doing it because that is his core skill set, right? So similarly, for the your expertise, if we say pediatrics, now there are many conditions in pediatrics. If you say geriatrics, then there are many conditions in geriatrics, but for which one or two conditions you have the strongest hold at, for which you can benefit the maximum fraction of society, right? For which you'll be able to do four more things for the patient as compared to any other therapist who is not so much expert of that kind of a condition. So this kind of medical and surgical conditions which you call, you should be creating the evidence based bank next. And then if you want to take up any time defined projects, for example, nowadays we talk a lot about text neck, right? So you can for these kind of special, or if you're looking to expand in some particular areas, or if you're looking forward to creating any project for say corporates, right? So you can have time defined projects, and then you can prioritize them at the third position. So once you're prioritized, you have your details, what kind of data, what kind of outcome measures, what parameters, what values and all. So then you assess the patient, and then you draw out the physiotherapy goals, of course, again, this will be in alignment with the your evidences which you have collected, and then you would be counseling the patient in the light of these evidences. Now here again it is blue, right? Blue is where you can understand that you are integrating the evidences, right? So once you counsel the patient, then you also have to ensure that you involve the patient in the outcome measures. So include patient's inputs and outcomes, right? Whether it be related to pain score or kind of a quality of life scale or whatever kind of outcome measure, whether qualitative or quantitative, but do include that into your overall outcome, and then you go on to summarize the outcome measures. Of course, it is a regularly repeated activity. So it's not only your measurement, but include patient's inputs. Why this is required? Because in case your results are not as expected, right? So you will have reasons, therapist reason, design reason, or patient's compliance reason. So you need to understand it's not kind of a scapegoat or something, but you need to rationalize. As scientific people, we need to rationalize. So once you summarize, then again you compare with the evidences, and then you ensure needful modifications, right? Then if you see in the top right corner of the slide, we had mentioned repeat 3 to 5, right? That is, once you ensure the modification, you again collect the outcome measures. But here, back here on step 9, it's mentioned repeat 4 to 5. So once you have you have obtained patient's inputs, and you have summarized, and you have compared your outcomes with evidences, and you did modifications, then again when you have measures obtained, then you again counsel the patient. Now here what will reinforce, it will keep your patient involved in the process, because normally a physio or an occupational therapist or a prosthetist orthotist who is not working on the basis of evidence based rehabilitation, if the results are not coming, even if the patient is compliant and not or non compliant, it's irrespective, but the patient will tend to lose regard, because they'll feel that this person is doing a treatment as per his or her understanding, and if the result is not coming, it is because of there is a lack of this analyst understanding. But the moment the outcome measures are discussed in the in comparison to the evidences that this you have this condition and this is what the values are, in this many number of sessions we should have reached this, but why we haven't reached, or why we have been able to reach, so it reinforces the confidence of the therapist in the program. It will increase their compliance to your design of program, and so you will have earlier results. Now once these are repeated and you are able to obtain clinical results, and then you'll have business data, right? Because you see, once you're doing this, you have actually institutionalized your rehab service, right? When we go to a when doctor's clinic, and when we go to a hospital, so when we go to a therapist who is doing a normal practice, and we go to a therapist who is doing an evidence-based practice, the whole perspective changes, right? The kind of experience which patients have, it really changes. So once you have summarized your clinical and the business data, how many patients obtained for that particular condition, and what was, now here we have great number of confusions, that whatever numbers we obtain, whatever values we obtain, can we use it for scientific? See, you may not be able to use it for scientific unless you have a ethical committee, ethics committee, it approves you for any kind of a study or something. But yes, you can always utilize to showcase to the public, to make the public understand that, see, this is about our profession, these are the scientific studies, and these are the kind of values which you normally perceive that okay, in so many days we haven't received, I am not feeling that much of relief, or I got relief after long extended period of time. So these are the scientific evidences, and related to that, these are the outcome measures from the patients whom we have treated in our clinic. Right now, see what is the advantage, because all this data, like in step like we are, when we talk about that, you will be discussing the outcome measures and the rehab plan in the light of evidences continuously. So no patient will come and speak in the market that no, you are producing any false data, right? So any, I mean, you need to safeguard your claims in the market, right? So you don't want anybody coming and saying, no, 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 I have been to this person's clinic and he treated me just like any other physio or occupational therapist or prosthetist orthotist, but didn't explain me these kind of things. But when you're actually implementing these processes, right, of course, when you'll need to get efficient at creating that kind of a process, so that will reinstate, that will reinforce, that will create, that will initiate confidence of the market into your services, right? So you have to create an awareness in the target market, and this is how evidence based practice can help you grow in the market, because everybody will perceive you as doing a absolutely scientific work. But as I said, if you are not able to convert this whole activity into an efficient process from 1 to 11, right, then adopting evidence based practice is just kind of a hindrance to your regular activity. It won't be fruitful for you in terms of market acquisition, or in retaining your clients. But at the same time, what I'll say is, if you don't adopt evidence based practice, if you don't invest your time, effort, and money, then your untapped and lost revenues, they'll keep on mounting up month after month, year after year. So if the basic question which we started with was, is evidence based practice a barrier to commercial success of physical rehab units? So my answer is no, absolutely no. It is a facilitator, given that the concerned therapist, the concerned rehab professional, analyst is able to convert this whole activity into a process. Now, how this has to be converted into a process is a matter of business designing, team building, and using technologies and streamlining things, automating things. So that's a separate issue. But if you are looking forward to, reducing the loss of revenues from untapped and lost revenues, then please do consider adopting evidence based practice in your private clinical career. So, if you have any queries, please feel free to write to me at starexercises@gmail.com, and I'm well accessible over call and WhatsApp on 7838682591. If you have any comments, if you have any queries, you can also put them here in the comments box, and you can also leave your contact details so that I can get back to you. So thank you so much for being with me through this session.